Good afternoon, everybody. My name is Carmen Wapagijik-Nuchtai, and I'm the Director of Health and Community Wellness for Tikmikshing and Anishinaabeg. Welcome to your health Q&A for this week. Today is Thursday, July 30th, and today I do have two members on our panel, and I'll let them introduce themselves. We'll begin with Rachel.
Hi, everyone. My name is Rachel Pattison. I'm the Health Programs Manager with Shawinigan Health Center here in Natick.
Hi, and I'm Amanda Jourdain. I am the Health Promotions Manager for Shawinigan Health Center in Tikmikshing.
Okay, miigwech. So about the spiking cases in the Sudbury and Manitoulin area. So as we all are aware, last night it was reported that 10 new cases are in the Sudbury area and Manitoulin area. There is one case in an employee of Pioneer Manor, which is following an assessment by Public Health. And in the Sudbury area, we've had 10 positive cases. Of those cases, majority are of travel, but some are not. So when we know that a positive case isn't from travel, we do understand that there is a spread of the virus within the Sudbury area now. So with that being said, we do want to talk today about keeping everybody safe in the community, exercising your precautionary measures, and ensuring that when you go to a store or visit anywhere in business in Sudbury, that you do wear a mask and that you exercise that 6 feet physical distancing, your respiratory etiquette, so cough into your sleeve, and any hand washing, always hand wash. So I will move on to Rachel, who will, or Amanda, who will discuss or talk about the regional approach to the reopening, and just to really ensure that if the Tikmikshing COVID response team, they are closely monitoring the situation, and if we feel that we need to decrease or increase our measures, we will take those recommendations. So go ahead, Amanda.
Okay, so businesses, services, and public spaces are reopening on a regular basis as progress is made in the fight against COVID-19. The regional approach recognizes that every region in Ontario has experienced the COVID-19 outbreak differently. Regions are based on public health unit boundaries and limited exceptions in unique cases. So directed by the province in consultation with public health officials, every region will progress through each stage when it is safe to do so. The Ontario government and the Tikmikshing's chief and council decisions are based on trends in key public health indicators, including virus spread and containment, along with health system and incidence tracking capacity. At Tikmikshing and Anishinaabeg's Order 200104 states that anyone traveling to areas with higher incidence of COVID-19 will have to obtain a test when you arrive home by calling the HSN Assessment Center at 705-671-7373 and isolate until negative result is received. If you choose not to get tested, you will be required to self-isolate for 14 days at home or in an isolation facility. Call Carmen or myself, and we will be able to assist you with the process. Shawinigan Health Center has a stock of isolation kits, as well as a capacity to help persons needing to self-isolate and might live in more crowded conditions and or live with someone with comorbidities.
So I just want to add in there that I believe you can call Marina McCumber, our community health nurse, and she can assist you with any isolation kits or if you have any questions with regards to COVID-19. Okay, Rachel?
And once again, Ontario is strongly discouraging any non-essential trips outside of the Sudbury, outside of your area. They have yet to lay out any formal rules about travel restrictions. All residents who are planning to travel outside should be aware that COVID-19 is still circulating in different levels throughout the province. The safest options are to stay in the area of your home and community or to stay in the region.
Mm-hmm. Thank you. So those who choose or have to travel, some individuals may have to travel for medical purposes, but those who have to or choose to, please make sure that you follow all public health guidance. Here are some steps to keep yourself and others safe. Always practice the usual personal protective measures, such as physical distancing, wearing a mask when it is impossible to maintain that 6 feet physical distancing, and for frequent hand washing. Maintain appropriate respiratory etiquette. Don't travel if you or someone with you is don't travel if for you and yourself and your family if somebody is feeling sick. Sorry about that. Monitor yourself for symptoms when you travel and when you return. If you get symptoms, even if mild, isolate yourself and seek that COVID testing by calling the HSN Assessment Center. Check all travel advisories for the destinations that you are going to. There are some variations, and sometimes there's some influxes of different positive cases in different areas, so it's always good to check before you leave. And then we'll go on to Amanda with gatherings.
Okay, so although permissible for up to 50 people indoors and 100 people outdoors, non-essential in-person gatherings of any size should be limited. Community spread remains possible and is likely in Sudbury and districts. Limiting our contacts and in-person interactions as much as possible is critical in reducing transmission of COVID-19. With a few exceptions, gatherings are currently maxed at 50 people indoors and 100 outdoors. Unless people are from the same household or social circle, they should keep 2 meters apart and wear a face mask if distancing is not possible. Face masks must be worn in all indoor public spaces, and they must also be worn in other indoor spaces where distancing is not possible. Close contact is permitted within social circles and among members from the same household. A social circle can only include up to 10 people and must always be with the same 10 people. You can only belong to one social circle.
We do recognize that, you know, it's in some areas we recognize that in some areas we do recognize that in some areas they are moving into phase 3, and we need to be diligent in what we do to keep our children and our elders safe. If you think that you've traveled somewhere within or outside of Ontario where you may have been exposed to COVID-19, or if you have any questions, please call Marina McCummer at 705-507-0134 or Carmen Wabigija-Nuchtai at 705-822-3462. There's you know, there was the provincial announcement today from the Premier and Minister Lecce regarding to the reopening of the schools. We just want you to know that we are planning to see how Atikameksheng is going to respond to that plan, and how we will be bringing forward a plan on how the community will respond to that school opening that was announced today. So just stay tuned for that. In closing, you know, we just want to remind you, you know, it seems very repetitive, everything that we're saying, but it is important to stay diligent and to stay strong with regards to all of this. So in closing, I just want to give you guys a few suggestions or ideas to prompt you on things you can do in Atikameksheng that still feels like you're moving around, but keeping yourself safe. We have so much land, and our backyard is huge. So, you know, get out there, go fishing, hiking, go walking in the trails. It's blueberry season, go blueberry picking, you know, walk around the community and explore our lands. We have lots of lakes. Go out and explore those lakes, go swimming, canoeing, hiking, kayaking. If you need any support with any of that stuff, then you know what, reach out. We're here. So take care and stay safe.
Yes, miigwech. So thank you for coming to this week's health Q&A. And again, I know lots of repetition, but it is because we want to make sure that our community stays safe, that you stay safe. And if you have any questions, always give us a call. The staff are always happy to help. Miigwech, and have a great week.